Welcome, my friends, to the Bob and Brad podcast. My name is Mike, and I am filling in today for Bob. Unfortunately, he came down with a cold, and his voice isn't quite up to par yet. So I am filling in for today's podcast with Dr. Abbasi. Dr. Abbasi is a two-time guest. This will be his third time. He is a board-certified neurological surgeon, and Dr. Abbasi is one of the nation's leading spine surgeons. He specializes in minimal invasive spine surgeries. On today's podcast, we'll be discussing how COVID can affect your back pain, as well as various types of spine surgeries. So without further ado, please welcome Dr. Abbasi. All right, well, I think we'll transition into our last category here. So this is kind of talking about what people should look for when they go to find a back surgeon, because not everyone can go to an inspired spine location, even though I did look on your site and you guys have a lot of different places now, don't you?
And we are expanding, surgeon and the patients are understanding more than ever what the value of this kind of services. We are building now centers in Texas, in California, in Florida, in many different states, and as well, lots of doctors are coming and learning this technique from us. So we are expanding very rapidly. But if your question is what to look for your spine surgeon, I think the common sense is the best you can have. Research your surgeon. Go Google them. Find out if they put the results out there, if they're open about the results. Once you see them, ask them question that matters, like, how long have you been doing these procedures? This is a legitimate question. How many of these procedures have you done? Do you do as well other procedures? Like, do you do this procedure? Do you recommend this procedure for me because that's the only way you know how to do the surgery? Or can you do 5 different surgery and you're doing it for me because in your opinion that's best for me? Listen, if they have like patient testimonial out there, listen to them. And I'm talking about like if you go and like put in YouTube OLLIF testimonial, you get thousands of patient testimonial online there. But as well, I think it's always between the surgeon and the doctor and the patient. It's a personal relationship. Make sure you feel comfortable.
Right. So I know we talked about this, but it'll be in a different video. But if someone like decided to travel to an inspired spine location to have surgery, how long do you think they would have to be there for, like location-wise, before they can travel home?
Yeah. Well, this is a question I can answer you based on actual patient. We get every week somebody who's driving or flying from all around the country to us for the surgery. The vast majority of the cases, after a day or two, they're ready to go, but we prefer to keep them at least 3-4 days. They don't have to stay in the hospital. We do the surgery, they go out of surgery center or hospital the first day, or same day as the surgery or next day. But it probably is a good idea to stay around and don't do anything excessive. And it's not about the flying back part that I'm concerned about, but imagine when you have been flying for yourself, you get late for the flight, you have to pull, you forget about everything, you have to carry luggage and so on. All of those are additional stress that we prefer for our patient not to have in the first few days after the surgery.
Right. So does Inspired Spine, what do you guys do when you bring someone in? Kind of like, what's your protocol or how do you examine them exactly that's different?
Yeah. Well, first of all, this is a secret of the spine surgeon, and we all know that we don't advertise that. Now you get all my secrets. Unfortunately, the type of the surgery you get or treatment for your spine you get has less to do with what kind of problem you have, has more to do who is the first person you meet. Like if you meet a chiropractor or interventionalist or pain specialist or surgeon who's specialized in minimal invasive versus open, the kind of knowledge they have is the more deterministic about what kind of treatment you get rather than the kind of problem you have. I can give you an analogy on that. Imagine you go with your car to car dealership, but the car dealership is not the same. You can have people who do paint job, people who do electricity work, people who do other things like they do your carburetor. Imagine it's random to whom you get. And if you get to the electricity guy, he fixed the electricity for you. If you get to the carburetor guy, same problem. You have the same problem, but depending on who you get to, different part of the problem get fixed rather than the problem itself. This is how spine is now in 2022. If you get to interventionalist, you are more likely to get for years injection rather than fix your spine. And if you get to a spine surgeon who is open surgeon, you may get a 3-level open spinal fusion rather than an injection, which could have fixed your problem, or physical therapy, who could have fixed your problem. And that is what we have changed. We have made a protocol. Literally, patient come, there are checklists that we have to check. Like if certain symptoms are not there, they don't even have to see the spine surgeon. They go to interventionalists, to physical therapists. But if there are certain areas are checked, they cannot be limited to just exercises. They have to see a spine surgeon if certain criteria are achieved. And those criteria are common sense criteria on the spine side, that if you have an unstable spine specialist, spine surgeon should look at it. So we have unified this kind of approach to help the patient to get the care they need, not the care that accidentally the provider has in his pocket to offer.
Right.
And these protocols, we call them multidimensional protocol. We bring providers in, we train them on that to unify the kind of care we give to our patients.
So your guys' protocol you created, isn't conventional in your mainstream hospital. How could mainstream hospitals try and incorporate that?
Yeah, no, there is another saying among the spine surgeon is that if you give same problem, one case to 5 spine surgeons, you come back with 7 different opinions.
Right.
So spine care is not unified. It can be different in one hospital versus another, with one surgeon versus another. And this cares, contrary, if you have a cardiac arrest or if you have a heart problem, those problem has been unified very clearly, but not spine. Now, I think our advantage here is that we can unify this, and we are spreading this knowledge to all the hospitals we are working with, is that we bring all the specialists on board. Like in our group where we create those protocols, we have physical therapists, chiropractors, interventionalists, radiologists, and by bringing everybody on board, we are creating a protocol that's acceptable to all providers rather than just to surgeons.
Right.
And I think that is why we can attract lots of attention to what we do, whereas radiologists create their own protocol, but nobody else cares about that. And the spine surgeon, they have their own protocol, but the interventionalists, physical therapists, don't believe that, don't trust in that, because they don't even know it. By bringing everybody to the same table and try to create a protocol that is a brainchild of all of the providers, then you can truly create a protocol that can be followed by all providers. And that is what we do. I'm not sure if that answers your question, but I think I went a little beyond your question.
No, it was a good answer. No, I was just wondering because, I would say most conventional places, everything's kind of separated. And with your inspired spine, you're all kind of on the same game plan, no matter who the provider is, what their field of expertise is. So,
no, I want you to give you an analogy. Like you just mentioned the word spine specialist or spine surgery. that means so much different, even in two hospitals next to each other. And patient think it's the same. It is not. Whereas if I tell you I had a Diet Coke, you know for sure that Diet Coke, what it is, you had it. It's the same Diet Coke. You can trust it. Like if you go to Africa, I would drink Diet Coke anywhere in Africa or anywhere else because I know it is what I expect it to be. Independent from its value, I know it is what it is, the Diet Coke. Whereas spine surgery, I may think apple, you may think orange juice. And for somebody else is the sewage. It is not the same. It is so far apart. It is not unified. This is what we are trying to do. That if we tell our patient, you need this treatment versus that treatment, if you have this condition versus that condition, that they can trust us. We are trying to create a brand that patient can trust with their spine problem.
Right. So I just got one more question here, I think, from the Bob questions he provided us that we haven't gotten to. How do you decide if someone may need back surgery, but not to the extent of a spinal fusion?
I compare a disc to a tire of a car, like literally a tire cushion the car against the road.
Yep.
And disc cushion two bones against each other. Now, do you always have to replace your tire? No. Sometimes you just have to put more air in it. Sometimes you have to patch it. Sometimes you need to change the valve. What you need to do with your tire of a car is very similar to what we do to the spine. Fusion is only one of the treatments that the spine needs. As a matter of fact, we are hoping that most of our patients don't need any intervention at all. But sometimes if they need if there's one small piece of the disc is pushing on nerve and the patient have more leg pain than anything else, we don't do a fusion at all. What we do what we call foraminotomy, macrodiscectomy, laminotomy. These are different procedures that tells we are cutting very small incision as well, size of my nail, and then we go with the tube that is about 1/2 inch to 1 inch, and then we trim whatever pushes on the nerve. That's not a fusion at all, and we do many of those procedures. But imagine you have a tire that has 55 holes. Are you going to patch that tire with 55 holes?
No.
No, you won't. Neither do we for spine. If that disc is beyond repair, the only feasible, reasonable way to treat that is get rid of that disc completely, and that's what we do. And that would be a fusion.
All right. Well, I think that gets everything we have for questions here. Do you have any last comments or remarks you would like to add about anything?
No, thank you so much.
All right, and that concludes today's podcast. I hope everyone enjoyed it. I apologize. We had some lagging internet issues, so hopefully I am able to fix it up enough so it is tolerable to listen to. Make sure to come back next time for more interviews with experts on the Bob and Brad podcast.